I'm Dr. Jennifer Joe, Chief Ambassador for JMIR Publications. Today, I'm delighted to interview Tina Pernot, Team Lead for Infodemic Management, Department of Infectious Hazard Preparedness of the World Health Organization, on her recent publication in JMIR Infodemiology. Her piece is titled A Public Health Research Agenda for Managing Infodemics, Methods and Results of the First WHO Infodemiology Conference. Tina, thank you for sitting down with us.
Thank you very much for having me. It's a pleasure.
At the beginning of the pandemic, the WHO organized the first global infodemiology conference entirely online during June through July 2020, and a follow-up on August through October 2020 to review current multidisciplinary evidence, interventions, and practices that can be applied to the COVID-19 infodemic response. An infodemic is an overflow of information of varying quality that surges across digital and physical environments during an acute public health event. It leads to confusion, risk-taking, and behaviors that can harm health and lead to erosion of trust in health authorities and public health responses. Ms. Pernot, can you tell us more about the conference and the inspiration for it?
Yes, well, as you mentioned, the infodemic can make it really hard for health authorities to manage the pandemic and also to manage epidemic risk in communities. So last year, we wanted to very quickly bring together scientists that have studied aspects of the infodemic so we can shorten this path between scientific evidence and knowledge and actions in the field. And we needed the conversation to be very practical and at the same time bring different perspectives, multidisciplinary perspectives to the table. So we actually took inspiration from how NASA problem solves when astronauts in outer space are faced with a life and death situation and the team on the ground races to find the solutions. So they create these teams of people of very different expertise who then do separate problem solving and then compare notes afterwards. And instead of red and blue teams like NASA, we created also green and yellow teams and involved scientists and practitioners from really across the globe. And imagine like a mix of people in 4 teams across over 35 countries and across 19 time zones. And you would, in the same discussion, hear a computational mathematician speaking with a risk communication colleague and a digital sociologist, or a historian discussing with a public health practitioner and a media and journalism researcher. And many participants later commented that the conversations actually encouraged them to think across disciplines, and several have struck up collaborations since.
That's fantastic. As part of the conference, a structured expert judgment synthesis method was used to formulate a public health research agenda. 110 participants represented diverse scientific disciplines from over 35 countries and global public health implementing partners. The conference used a laddered discussion sprint methodology by rotating participant teams and a follow-up managed process to assemble a research agenda based on the discussion and structured expert feedback.
What naturally came out of the discussions was that we need to systematically approach infodemic management. Just like, for example, epidemiologists use epidemiology when they prepare and respond to epidemics. And they use different tools and methods for epidemic management, depending where along the epidemic curve the outbreak is. And we've learned about the epidemic curve now for the last year and a half quite a lot. So, in a similar way, infodemiology can bring through metrics and tools and methods for preparing and monitoring and detecting and intervening, and then strengthening and enabling infodemic management. And each work stream identified proposed research questions. So they were very heavily skewed towards near-term feasibility and high impact on public health. And this is because we really wanted to see what questions can help generate evidence that then health authorities can use for infodemic response even during the COVID-19 pandemic. And the top 3 research questions, for example, they really aim at what can help us intervene better. So one, for example, is that not all misinformation leads to the same harmful impact. So one research question is, how do we decide what kind of misinformation we need to pay attention to over others? And then at the same time, what can we expect? Can we expect that at any time, public health or social measures or immunization, when they change, well, we can expect that infodemic will follow as well. So another research question relates to this, because infodemic comes in waves, just like outbreaks. We also then need to ask, what would a preparedness assessment look like for infodemic preparedness when we design a health intervention? And these are all very practical questions where we need science and evidence to then inform practical options for health authorities to respond.
You've highlighted the need for public health authorities to develop, validate, and implement and adapt tools and interventions for managing infodemics and acute public health events in ways that are appropriate for their countries and context. What are the main takeaways or conclusions that you think people should know?
Yeah, well, you know, even though infodemic management is a nascent public health practice, multidisciplinary evidence is already filling these gaps in knowledge. But we really discuss, you know, some of the takeaways in the paper, but really the three that are close to my heart deal with this need to be as practical as possible. So first, we need to take extra care to bridge between research, practice, and lived experience of people. And this must be really a deliberate action if we want to effectively and as quickly as possible respond to infodemics. And we really need to continue to think across disciplines and public health practice. The second one is, well, to prepare for and mitigate the harm from infodemics, we need to imagine a healthier information ecosystem as a whole. And that means that science can provide evidence to discuss from different perspectives. We usually discuss from perspective of an individual, you know, from point of view of health literacy and being resilient to misinformation. But we also need to take a look at perspectives like societal and community and algorithmic role in infodemics, ethics, platform, and these are just a few. And then the third perspective is that if we want to use information better, we need better data, information, and evidence. This isn't new, but I cannot stress enough that without them, our interventions just cannot be precise enough. So we need to build systems that will provide us the metrics and the measurement that we need to monitor, detect, respond, and evaluate what we do. And this is where infodemiology comes in, and we're very proud to be contributing to the new infodemiology journal with this paper.
This is Dr. Jennifer Jo, JMIR Ambassador. I want to say a big thank you to Ms. Tina Pernut, Team Lead for Infodemic Management at the Department of Infectious Hazard Preparedness, the Emergency Preparedness Division of the World Health Organization in Geneva, Switzerland. Thank you for letting me interview you on your JMIR Infodemiology publication titled A Public Health Research Agenda for Managing Infodemics, Methods and Results of the First WHO Infodemiology Conference. Big congratulations on creating this novel framework for managing infodemics and acute public health events. To read the full paper and other great research, be sure to go to jmirpublications.com. As a reminder, all articles are open access, meaning they are free and available to any user anywhere in the world.